communications departments here who have been working on bringing it all back together. As you know, for a number of years now, we have been holding these immigrant media roundtables because we recognize how important of a role you play in making sure that our immigrant communities have the information they need as they go about their lives in the city of New York. I often say in these roundtables that we need to recognize and do better in communicating with our immigrant New Yorkers. Over half of all New Yorkers get their news in their own language through you. And so it only makes sense for us to hold this immigrant roundtable as consistent and as often as possible. When I first joined the administration, I heard directly from you. I had worked with many of you for a number of years as an advocate, and I heard your calls to make sure that City Hall was more accessible. And so here we are, once again, coming together to discuss very important issues. Very proud to have here our new Deputy Mayor of Health and Human Services, Deputy Mayor Suzanne Miles-Gustave, who will share a few words with you. But I've had a chance to work closely with the Deputy Mayor over the last month on the many issues that we've discussed here, and I can confidently tell you that Deputy Mayor is really the right person to be leading our work, our portfolio. She deeply cares about immigrant communities, about all New Yorkers. And as we have always said under the Health and Human Services team, we're here because we care. We care about all New Yorkers. We care about all vulnerable populations. And I have been working very closely with Commissioner Morse since the transition to this new federal administration occurred. In fact, Commissioner Morse was one of the first commissioners I met with to discuss the impacts that transitions in policy, transitions in approach will have on our immigrant community. So thank you, Commissioner Morse. And of course, you've met Dr. Jiménez many times in this roundtable because NYC Cares is amongst the most important programs for our immigrant communities, which make healthcare accessible to our immigrant communities. Lastly, I want to point out some of the new materials that we published this year for our immigrant communities. If you don't have them yet, make sure to take a look at them. These are materials that our team put together that are tailored to the needs of our immigrant communities at the moment. They describe the policies and the laws that they need to know about, our sanctuary city laws and policies, which remain unchanged. Same sanctuary laws and policies that existed in the many years before now continue to exist. And we want to send a message today. Our communities should feel safe in accessing our city services because there are laws in place that protect their information, that make it possible for them to access city services, including healthcare, without the fear of any immigration consequences. And I say this because this has been an issue that we have undertaken in the last couple of months to make sure that our communities feel safe to accessing the hospital system and the many programs available to them. And my colleagues in the Department of Health and Mental Hygiene and at NYC Cares and H&H will talk more about what that means. But now I want to introduce to you our new Deputy Mayor of Health and Human Services.
Thank you. Thank you, Commissioner. Good morning. Thank you all for being here with us. Appreciate the invite, Commissioner and Dr. Morse and Dr. Jiménez, for all the work you've done. So we are really here to continue, right, to build upon the very strong relationship that exists between the administration and immigrant communities across the city. And that relationship is one in which we work together to share information, to provide access, so that folks know what's available in the city. And we're also really here to reaffirm that the immigrant communities across the city have access to healthcare, to school enrollment, to emergency services like 911. We want to make sure that every individual, every family member, every child knows that New York City is and will continue to provide those services to communities across the city, regardless of immigration status. Which is why it's really important that you all are here, right? As our media outlet partners, it's critical that we are communicating together so that you can then communicate to communities in New York City that this information is here, this access is here, this open door is here, not only for the communities, but for our outlet partners as well. So again, thank you for being here to have this critical conversation about this wonderful report that we just released. Thank you, Commissioner Castro, for your leadership. I will turn it now over to Dr. Morse, and you will then later hear from our partners at H&H. But thank you very much for continuing to partner with us.
Thank you, Deputy Mayor. Good morning, everyone. And thank you, Commissioner Castro. Thank you, Dr. Jiménez. It's really an honor to get to be here to talk about what is such important and timely work here in New York City. I'm going to start off by just talking a little bit about the history of some of the work around protecting health of immigrants in New York City, and then the highlights from our just recently released yesterday Immigrant Health Report that hopefully you all will take a deep look at. This year marks New York City's 400th birthday, and it's the 220-year birthday anniversary of the New York City Health Department. We have a long and proud history of caring for everyone without exception. And today our commitment to healthcare access remains unwavering, regardless of immigration status, ability to pay, or English proficiency. Continuing that tradition of care for everyone with no exceptions, we've produced a new report on the health of immigrants in New York City. It reveals some very encouraging trends. First, that immigrants in New York City have a higher life expectancy at 83.5 years, which is much higher than US-born New Yorkers who have a life expectancy of nearly 80 years. Immigrant populations, particularly women, exhibit lower smoking rates than US-born New Yorkers, and immigrants also play a crucial role in New York City's healthcare system. They comprise 47% of the workforce in healthcare practitioner and technical occupations. So our healthcare system is literally fully dependent on immigrant New Yorkers. The report also illustrates an array of challenges that local immigrants face, including language barriers, workplace issues, limited access to healthcare and education, and difficulty navigating our legal system. In New York City, 15% of immigrant adults are uninsured. That's about double the rate of US-born New Yorkers. We also see inequities in access and care. Immigrants with depression are unfortunately less likely to receive mental health treatment compared to US-born residents. And when we look at chronic diseases, conditions like diabetes, hypertension disproportionately affect certain immigrant groups. In recent history, the pandemic laid bare the devastating impact of systemic inequities, and our immigrant workers who were in essential sectors died of COVID at a disproportionately high rate. That unfair pattern and the unfair patterns I just described come from bias against immigrants or xenophobia, racism, unfair access to employment, being more likely to work in high-risk industries, and insufficient translation and interpretation services. All of these barriers create significant health obstacles for the health and well-being of immigrant New Yorkers. And again, this is all outlined very clearly in the report. The report is over 70 pages, so get ready. Protecting our immigrant New Yorkers is not just the right thing to do, it's a public health imperative. A lack of access to care for some of us translates into delayed care, preventable illnesses, and ultimately poorer health outcomes for all of us because we're all connected. We know that everyone's health is undermined if people are afraid to go to a doctor. That's why New York City's laws are designed for everyone to be able to call 911, go to the emergency room, access primary care, or send their kids to school without fear. Upholding and investing in the trust and dignity of immigrant communities is essential to a safe and healthy New York City. We're living through an extremely intense period of immigration enforcement that has direct consequences for our health. Recently, we published an open letter to immigrant New Yorkers written with New York City Health Hospitals and Commissioner Castro at the Mayor's Office of Immigrant Affairs. The letter reinforces our steadfast commitment to healthcare access for all, and that includes privacy for all. As the city's doctor and acting health commissioner, I can assure you that when you visit our healthcare facilities, you are not required to share information about your immigration status to receive care. An open letter is our love letter to immigrant communities, and in it we outline that the city healthcare services are available to all New Yorkers, that there are protections afforded to immigrant New Yorkers who are seeking care, And we encourage all immigrant New Yorkers and their families to seek care when they need it without fear. It does take all levels of government to continue this work. Together, we can work to reduce barriers to meet everyone's basic needs for housing, education, and health. This involves directly engaging with immigrant communities to create and share resources about available services and their rights. So this is where you come in. To successfully reach immigrant communities with messaging that is literally life-saving, we rely on trusted messengers like you. We tailor our approach to public health to fit the distinct needs of our diverse and unique communities in New York City. And as journalists, each of you play a key role in furthering our mission to protect and promote the health of all New Yorkers without exception. Thank you for all that you do. And in conclusion, I just want to underline again, investing in the health and well-being of immigrant New Yorkers helps our entire city and country thrive. Now more than ever, we know immigrant communities are being targeted and singled out in unfair ways. At the New York City Health Department, we will continue to partner with and advocate for immigrant New Yorkers. Together, we can make sure everyone gets the care they deserve. So thank you. Yeah.
Thank you. Thank you, Commissioner. I recommend the report. It's amazing. I had to read it last night. It's amazing and really helpful to understand the health and the needs of our community. Thank you, Commissioner Castro, Commissioner Miles-Gustave. I'm really proud to be here today because immigrants from all over the world and of all kinds have really built this city and this nation. And I'm proud to count myself in that lineage as a child of immigrants who were once undocumented as well. And to celebrate Immigrant Heritage Month and Week. And I'm proud to work in New York City Health and Hospitals because regardless of your immigration status or your ability to pay, we serve everyone. We take care of everyone. There are no exceptions. And through the NYC Care Program specifically, which I get the honor to lead, we take care of uninsured New Yorkers. They get a membership card. They get 24/7 access to pharmacy benefits. They get their own primary care doctor. And already for 5 years, NYC Care members have been taking advantage of primary, preventative, and specialized care across our 11 hospitals and over 30 community health centers. In fact, NYC Care members have completed over 1 million visits since the inception of the program. And just in the last month, over 13,000 visits were completed in primary care. And so we continue every day to serve New Yorkers, as Commissioner Morse was saying. Your privacy, the privacy of our immigrant patients, along with the privacy of all our patients, is incredibly important to us. And it is protected by law. So we only release patient information with the consent of the patient or if we're required to do so by law. And we don't record your immigration status. We only ask about it as related to eligibility for benefits. And you're not required to give it in order to receive medical attention. Healthcare is your right in New York City. We have also issued clear guidance to staff in the event that ICE enforcement and are committed to safeguarding the privacy of our patients to the fullest extent of the law. And part of this roundtable is continuing the work of getting the word out about the right to healthcare in New York City. And we're continuing to do that in other ways. We continue to work with 22 community-based organizations that have been in the community, working in the community for many, many years to make sure to get the word out about healthcare and NYC Care specifically. We are planning days of action to engage every single borough and every community to know about their rights. And additionally, we're launching in the coming months a new marketing campaign with new images to encourage New Yorkers and immigrant New Yorkers specifically to take advantage of the services available to them. So to finish, we're committed to the right to health care in New York City, regardless of immigration status or ability to pay. And we encourage anyone who doesn't already have a primary care doctor to give us a call at 646 NYC Care. If you know someone who doesn't have a primary care doctor, we encourage you also to give them the number. And also you can visit nyccare.nyc if you have any questions about the program before you call. Thank you.
Thank you all. And I just want to point out that you see the poster boards. These are Know Your Rights posters that are also across 4,000 digital screens in New York City. If you scan the QR code of, let's say, the Russian poster, you will be automatically taken to our Russian website where you can access all of the Know Your Rights materials in that specific language. So if you don't see your language here, please reach out to me. We do have extra poster boards. But this is super, super important information to get out to the community because just with the scan of the QR code, they can get access to the latest information on federal immigration policies, but also resources. And you see two numbers there. One of them is MOIA's, Mayor's Office of Immigrant Affairs, legal hotline, immigration legal hotline. When folks call that number, they will be able to get more information and even access to some legal services. And then 311, always, 24/7, that hotline, both of these hotlines are safe for immigrant New Yorkers to call. So,
So before, just one thing to add. As far as we know, uh, combined with the 4,000 digital screens, the resources we provided for Know Your Rights training in person, and everything else that we have done in the last several months, we have launched and are conducting the largest campaign in the country. And that should say a lot about our commitment as the city government of New York to our immigrant communities. And I want to say, and I want to make this very concrete. One of the issues that immigrant communities that we interact with on an everyday basis come to us with is their concerns to continuing to refill their medication, to continue to treat their, diabetes, their hypertension, and other chronic illnesses. But they're afraid to go into the hospital. They're afraid to get in their refilled, their medication refilled. That to us is incredibly concerning, of course, because this can have other unintended consequences, which is why we're here today, because everyone here, every leader in this table here today is committed to the healthcare and well-being of our immigrant communities. There's an important debate happening. We want to distinguish between that debate over our sanctuary policies, over immigration, and what's in place currently in the city of New York. And you've heard from our commissioner, from Dr. Jiménez, Deputy Mayor, there are laws in place that continue to provide the, the, the resources and the services that immigrant communities need in the city of New York. And the back.
thank you, Commissioner. So with that, I'm going to open up the floor with Q&A. Great. So we'll start around the room. If you could just introduce yourself and the outlet that you're covering.
Excuse me. Hi, I'm Ozzy Heyman with Davidson Media, which is Davidson Radio, largest Russian language radio station outside of Russia, and RTN Television, which is the Russian Television Network of America, solely owned by Americans, in case anyone's worrying. There is no worry. And personally, if I can be objective for just 1 minute, I want to say on behalf of our community, Russian-speaking New Yorkers, thank you for your team's efforts in reaching out to the immigrants. Now, getting back to being a little bit more objective, throughout everything that was said here, you were assuring people, whether they spoke the language, whether they knew the system, meaning the healthcare system, whether they had insurance or not, they can get whatever healthcare they need in New York City from your program. I believe it was New York City Care, but from the city. I just want to make sure that I'm accurate in what I just said. Anybody, any immigrant or not, can get the medical help they need for free.
Yes, I mean, so because we are committed to serving everyone, regardless of their needs, status, or ability to pay, and fact, we have a right to healthcare in New York City. We have the largest public healthcare system in the country, crown jewel of New York City, and we're here to serve all New Yorkers. We have a very affordable fee scale, I'll add, that is according to household income to ensure that whatever care you need is affordable to you.
Thank you.
Hello, good morning. I'm Ramon Jiménez from Telemundo 47. I guess I have to make this question in English, but probably later I will stay with Commissioner Castro and Dr. Jiménez, Spanish for But my question is for since the moment that you launched the New York City Care, you have been very making emphasis to the community that you will protect their immigration status and the law prohibit the city to share this information. But the fear in the community is very intense right now. There are people that they keep hearing this message, but they're not going to the hospitals, and they are scared to like go for a regular check if you are a pregnant woman. So, Dr. Jimenez, you mentioned that you have a new campaign right now. You launched a new campaign, right?
We're going to be launching it.
You are launching a campaign. But what other step are you taking to be more close to the community? To go probably people that you already have in your system because they happen in the hospital, right? To like contact them directly, like call, don't be scared, like the immigration is not going to be here. Because I see two very devastated situation in the future. First of all, I guess for the hospital, for health and hospital, the increase of the to pay for the insurance is going to be higher because people will go to the hospital when they are almost dying instead of taking care of their health problem little by little. And then for the patients that sometimes they are so scared and they're going to wait until the last minute and can be like last train, like instead of keeping the regular. So the question is that is there is extra step you're doing to reach these people like person to person?
Well, I'll start and then I'll hand it over to Dr. Jiménez, and I'll do it in Spanish. That's all we do. La salud y la seguridad de nuestras comunidades es la prioridad de la ciudad de Nueva York. Y queremos enviar un mensaje muy importante a nuestras comunidades inmigrantes, que las leyes que protegen a los inmigrantes, nuestras leyes de ciudad santuario, continúan, no han cambiado. Y por lo tanto, pueden acceder a los servicios de salud, a los hospitales y a todo otro servicio que históricamente la comunidad migrante ha tenido acceso en la ciudad de Nueva York. Queremos enviar este mensaje muy importante a nuestras comunidades. Continúen yendo a sus hospitales, atendiendo su salud médica, y si tienen alguna pregunta, algún temor, pueden llamar a nuestra línea directa donde les contestaremos todas sus preguntas. Pero queremos que esto quede muy claro. La ciudad de Nueva York sigue siendo una ciudad santuario. Seguiremos apoyando a nuestras comunidades, inmigrantes, indocumentados o no, y estamos aquí para apoyarles.
Sí, bueno, puedo decirle que el miedo que usted ha nombrado lo he visto yo mismo, los pacientes, cuando los veo en la clínica, pero sin embargo siguen viniendo y queremos a través de los medios que están aquí seguir mandando el mensaje que pueden seguir viniendo a recibir su atención médica, sus medicamentos. También seguimos trabajando con las organizaciones comunitarias, como les dije, 22, mandándoles mensajes que pueden ayudar a esos que pueden tener de pronto demasiado miedo para venir, avisarles que hay oportunidades de recibir cuidado virtual, por ejemplo, también compartiéndoles nuestras pólizas que protegen la privacidad de los pacientes, también si en caso de que inmigración llegue a una clínica. Y también le hemos mandado mensajes directos a nuestros pacientes para que se sientan a gusto de continuar recibiendo atención médica. Y hemos visto que todavía la gente está viniendo a pesar del miedo. Y por eso estamos aquí para resguardar sentimiento de seguridad que sí todavía existe a pesar del miedo.
Can you say briefly what?
Yeah. No, obviously, yeah. So what I shared is that I have seen the fear, certainly, in my patients that I see in clinic. And it's important to acknowledge that fear, but I've been encouraged because people are continuing to come and receive the care that they need. And part of my highlighting that is that even in the past few months, we're seeing a steady amount of completed appointments at our clinics. People are continuing to come, and that's great. And we're taking additional steps to encourage people to continue that and give them other options as well. So through our community-based organizations, we've disseminated information on how to take advantage of virtual visits, telehealth visits, in case you are maybe afraid of coming in person. We also shared our policies around how we are going to protect your privacy and should ICE show up to any of our facilities, how we're handling that in order, again, to encourage folks that they're safe to come and get care at our facilities and clinics. And we're doing a lot of that work through our community-based organizations. And we've also sent messages directly to our patients, sharing with them this information, and that nothing, to great measure, nothing has changed for us as a city. Right? We're still here to serve everyone, regardless of immigration status or ability to pay. We serve everyone without exception.
Thank you.
Thank you. We're gonna go to
Yeah. My name is Mohsen Zahir. I'm with the Urdu News. Can you tell us more, little bit about virtual and telehealth visits? How someone can have these kind of visits with the physician or the doctor? What is the
Yes.
procedure?
Yeah, the procedures specifically, so there are different ways. And you can get in touch directly with your clinic, the New York City Health and Hospitals clinic, to schedule telehealth appointments. And we have actually ways of that patients can engage in telehealth regardless of their, if they have a special app or not, which is great. It makes it much more accessible. So I encourage people to take advantage of that if they need it. And if you have MyChart, which is a platform that we encourage all our patients to sign up for, it's an app that's available also through the internet. That also makes it easier for you to schedule your own telehealth visits, should you want to, and through the platform also engage in care. So those are the two main ways, should you need it, to engage in virtual and telehealth.
Can I just add to this? I'll add to this because it's an important message that came directly from this was an important message that came directly from the president of the health and hospital system. They've done everything possible to expand their access to telehealth, recognizing that our communities may feel fear in going to their hospitals in person. And so the health and hospital system, NYC Care, and the city of New York recognizes that we need to do something about this. And one way we're addressing this is by expanding the access to telehealth to our immigrant community.
Thank you.
My name is Lodi Mujib from Pakistan News. Just very briefly, there's a lot of people, they're still illegal. How they can get the health care?
Well, I think this is why we're here, to really send the message that whether it's New York City Health and Hospitals, the Department of Health, we serve everyone regardless of immigration status. And so if you're afraid to get services because you're undocumented, we encourage you to continue to reach out, to find out more, to call 646 NYC Care, and take advantage of all the programs we have available.
They're asking for Social Security and a couple of other stuff. They don't have it. So still there's a lot of points is lacking. How we can solve that?
I was going to say, Dr. Morse can perhaps speak to some of our findings in the amazing research they've conducted, the lack of information that exists out there, and this is one of the things that we've identified, the progress, but also the work that needs to be done.
What we found in the report is that there is one of the most effective ways to get information out to communities has been through you all. And in addition to that, making sure that every language possible is used in all of our materials and all of the education work that we do in communities. I also want to highlight that the health department runs sexual health clinics, as well as tuberculosis clinics, as well as vaccination clinics. All of those clinics are completely free of charge, and there are no copays. It is open access. We also have walk-in appointments for many of those clinics to make sure that there are zero barriers to care. And in addition to that, any language that is preferred for the patient that's being seen in these clinics, again, you can literally just walk right in. No one is going to ask you for any documentation that might reveal your immigration status or things like that, and you can get the care you need in the language that you prefer. But those translation services, in addition, are a huge part of what we try to do.
You want to talk about the requirements to enroll in NYC Cares, because that's.
So NYC Cares is focused on making sure people who are insured, whether it's because they're ineligible for health insurance or because of their income, can still access primary care. And part of the process for doing that is getting screened for health insurance. And we recognize that can be a fearful process, especially now. But we only ask about immigration status as it is related to eligibility, and that isn't recorded anywhere. So that's important for you to share with the community. And so that's one. You have to live in New York City is the other important requirement. But otherwise, there's no income threshold. Our goal is to make sure we can serve everyone, regardless of immigration status or income.
And so if you don't have a social security number or immigration leave, you won't be denied.
Absolutely, absolutely. And in fact, you're not required to provide that information as well. So that's important.
I have a record in my newspaper. There's a few people that don't have a social security. They gave a card, health card, but later on they canceled, they denied.
My understanding here is that there's been some changes around when some folks first arrived, what kind of immigration documents they had could allow them to enroll in health insurance, and that may have changed later. So that may be what you're getting at, but it also highlights the importance of going through the process of getting screened. If you're able, you may be eligible for health insurance. And so that's part of why we go through that process. And it's better for you to have health insurance if you can. But if not, you still have a right to health care through NYC Care, New York City Health Hospitals, and the Department of Health, and all the services they provide.
There's a difference between NYC Cares, the program, and other private insurance companies. That's the difference that we have to make sure.
And then I was, excuse me, also just going to add that if there's a specific case that you have in mind that you want to talk with any of our insurance enrollers about, we're happy to do that. And I can give you the information for how to get directly in touch with them. They can also often help figure out what might have gone wrong, in addition to helping figure out if someone is eligible for insurance. And they have a very long list of health insurance options that they can really talk through. And again, that service around insurance enrollment is also in any language that is preferred by the person who's calling. So we're happy to connect you with that.
My name is Javier Castaño from Queens Latino. There are too many things to talk about the health of the people in the city of New York, but I like to focus on something. I live in Jackson Heights. That's like 5 blocks from the hospital. That hospital has a very big psychiatric unit. And in the last months, I have seen many people like acting weird, erratically, and many of those are immigrants. And this is very easy to see. And then on my way here to this meeting, I took 3 trains, and in the train I saw some people also sleeping in train. Some of them acting also very rapidly. So my question is, and because of this situation with the new immigrants, is what the city is doing in terms of the health, the mental health of the people, especially those new immigrants that are afraid even to go when they develop another symptom. The mentally illness is very, very difficult to create and help. They don't look for assistance. What the city is doing, especially that the rate of suicide is even increasing.
I can take that question and thank you for raising concerns around behavioral health specifically. It is certainly an area of intense focus for us in the New York City Department of Health and Mental Hygiene. So I'll start by just saying that access to behavioral health care is a huge challenge. And we're working in many ways to increase access to care. There are a number of programs that are being expanded, particularly for people with severe mental illness. And those programs, again, are some of our most not only important programs, but programs that really help to prevent homelessness and prevent some of the other health outcomes that can come from suffering from severe mental illness. It's certainly a challenge for immigrant communities, but it's a challenge for all New Yorkers, unfortunately. This is something that we are seeing and watching very closely and working very closely with the State Office of Mental Health to address. And the report that we just released yesterday on the health of immigrants did show that there is an inequity around behavioral health access, that New Yorkers who are immigrants have less access and less care when it comes to behavioral health. So that's certainly a concern, and it's part of the reason we thought it was so important to describe that with data in the immigrant health report, because part of our call to action is that all the healthcare providers that read this report can look and say, aha, this is an area that we need to focus on, improving access for care. So those are some of the things that are happening around behavioral health, but I will acknowledge it is a significant challenge, and access to care is one of the biggest challenges both for immigrants and for all New Yorkers.
And I'll just reiterate that to Dr. Morse's point, mental health and behavioral health has been a huge priority for this administration for the entire time that this administration has been in office. And to Dr. Morse's point, it is not perfect, and we continue to prioritize to hopefully expand programs to reach all New Yorkers. And that goes to our outpatient and folks who are exiting hospitals that still may need some level of outpatient care. Sometimes, as Dr. Morse said, we're trying to prevent that homelessness pipeline. We don't want that to continue. So we're focusing on all those elements and trying to continue to increase access to behavioral health. It's a issue, as I'm sure you've all seen as you walk through New York, and we're super aware of it.
And lastly, as New Yorkers, if you see someone that needs care and perhaps cannot find it themselves, you can call 311 or you can call us, anyone in this table, to make sure that individuals that you're seeing or that you know of can get the care that they need. Often they don't know themselves that they need care. And so that's an important message, and they'll get care in their own language and with providers that understand the pressures they're in. And our health and hospital system is among the leading healthcare systems in mental health services, and they'll get the support that they need there.
And I would just add also that sometimes we make a distinction, between medical care and behavioral health. And in primary care, I see patients, like I said, every week. It's one and the same. The behavioral health is intertwined. We created models of care that expand access by, for example, partnering social workers or counselors with psychiatrists and the primary care doctor, the primary care provider, in order to provide broader access to anyone who comes to our system. So, not to keep harping on going back to NYC Care, but would love for folks, anyone who needs any care, whether it's behavioral health need or physical health need, to come and engage in care as a starting step to get the care they need.
roundtable, and thanks for carrying the immigrant community. I could feel you really embrace all the community together. So I heard that you have receive medical service prescription regardless status. But I believe people are not going to hospital because not only the legal status, but also there is some perception. They think the hospital is really expensive. So in my personally, I took my child to the hospital once. He had a spine, so he had a steroid injection, one shot. But that charged about 1,450. But I got exactly the same treatment in South Korea with $10. So I feel like people are not going to hospital because of the status, but also they know that it is financial burden. They don't know how much they charge you. So what kinds of effort or what kinds of you are doing for uh, lower the charge bill? It is not only NYC, it is like whole nation, not only immigrants, it's United Nations.
I can start and then certainly happy to hear from others. It's such a phenomenal question. I'm glad that you're raising the point that some of the concerns about accessing healthcare are not new. This is a long-standing challenge. I first want to start by just talking about Medicaid as a program. And part of the reason I want to talk about it is because it is under threat. Medicaid is one of the health insurance programs in the city that is the most widely used. And it's one of the programs that you do have to qualify based on your income and based on a number of other variables. But half of New York City is on Medicaid. And the reason I underline that is because Medicaid is one of the programs where costs like co-pays or out-of-pocket costs are extremely low and sometimes zero. And the reason I mention that again is that those are the programs that we know help to make sure that New Yorkers, again, regardless of their ability to pay, are getting the care that they need and don't have bills or co-pays or medical debt because of it. And that is a program that is currently under threat, unfortunately. So it's one of the programs we have to protect because so many New Yorkers use it, and it allows for procedures like you're describing at almost no cost. Again, if you qualify for a certain, if you qualify for Medicaid. The other thing that I would mention is that healthcare costs are a significant concern for the city. New York City is widely known to be the most expensive healthcare market in the whole entire country. And we in the health department run the Office of Healthcare Accountability. It's a new office that was created by Local Law 78. That office is really intended to look much more deeply at why healthcare is so expensive in New York City and use some of the federal laws that are requiring price transparency of hospitals to show New Yorkers where they can get care. So we'll be launching a website that allows New Yorkers to look at costs across different healthcare institutions and choose where they might go based on those costs. And that's again based on widely available federal price transparency data, but it brings it into a way that a consumer or a average New Yorker can look on the website and find a place to go. And the office just released our inaugural report a few weeks ago. It showed, unfortunately, that outpatient costs, just like what you're describing, are the main costs that are driving the rise in healthcare costs and prices across New York City. So that's an area of focus for this Office of Healthcare Accountability as well. But we do hope that the price shopping tool will help to meet some of the needs that you're describing. And we also know, again, that Medicaid must be protected because half of New Yorkers are on a health insurance plan that make sure they don't have to pay a cost like you're describing.
I just want to reiterate that the Office of Accountability, like cost transparency in healthcare is a national issue, international, as you mentioned, and New York City is really going to be a leader in this. Once the website gets launched, and right, consumers should know how much they have to pay for certain procedures so they can be that responsible consumer and price shop. Talk about the industry and how competition arises. So New York City is a leader, and I can't wait for that to launch because we are aware that cost is a barrier and it should not be. To that extent.
Can I just say one important thing? There's a distinction, this is the message for American communities, there's a distinction between private hospitals and public hospitals, private systems and public systems. And we have amongst the best public And I know that in our home countries, public health care systems have mixed reputations, but I have to tell you, we have among the best public hospitals in the country. And I want to point out that you'll have access to some of the best doctors in the country, including Dr. Jiménez and Dr. Morse. Both of them are practicing healthcare doctors in our healthcare system. In fact, Dr. Morse shared with me that she continues to see patients at Kings County Hospital. How amazing is that?
So make your appointments now.
And Dr. Jiménez, of course, is a medical doctor, primary health physician at our Gotham Health Clinics, and I think Elmhurst or
Cumberland.
Cumberland. And you know, the president of the H&H, our Health and Hospitals, is also a president, and so on. Almost everyone we work with continues to have a relationship in our healthcare system. And again, you'll get screened when we go to our NYC Cares and go to H&H Hospital. And I wish more people who've had those experiences can share and spread the word about their experience. You know, I've heard of many people how grateful they are that they can get access to diabetes medication at like $3 or $5 a month, which is why they're so nervous, because they want to continue to go get their medication.
Yeah, I completely agree. Thank you for those comments. I would just, for me, you know, we are really focused on uninsured population, and even for them, I want to emphasize that. That's why, you know, your concern, people's concern about costs are so important. That's why we put the fee scale that people can expect to pay on the back of the card, so that they can be reassured they're not going to get a scary bill, and it's very affordable. In fact, New York State actually passed a law, I believe last year, that made it so that charity, for the fee scale for uninsured people in our hospital, of course, but also in other hospitals, is very affordable. $0 for primary care visits, $0 for prescription medications, when you're under 200% of the federal poverty level with respect to income. So I think to that, you know, concern, absolutely continue to come and get the care you need. Definitely with us, we want to work with you to make sure that you get the care you need and that it's affordable.
So Shayna, before, if we want to leave a few minutes for one-on-one
Yes.
meetings, right?
Yes.
Should we do closing remarks? And then
Yes, I know we had a couple of questions left. If you can all ask your question, and then in the closing remarks, they will address them, okay? So go for it. Yes.
All the talk about massive deportation, the figures so far don't show it because they're not significantly higher as compared to private administration. But eventually, these people, they have their talents, and they seem to be determined to meet their talents. So I understand that we have the century almost so far on those confessions. But it's like the way this administration is going, they have a target. They have something we have to work per month, per week, and so on. It seems to me the challenge is huge. Cities and states, they cannot find this separate they can do it. There's some betting, some coming together, cities and states. So the question I'm putting to you is that, are you aware of the attempt for the cities to balance into some uniform work to challenges? Because I see a train coming with full force.
Thank you for the question. Let's do all the questions and then we can respond.
Yes, we'll respond to this.
Good afternoon. We have the largest radio system in the New York area, and we're very happy to get this message beyond the walls of this room. And on a regular basis, we are in touch with her. She grabs, so we could have regular bulletins that we could send it out. And to, in addition to regular medical care, I think meditation could be a great help. And my part of the world is known for very good meditation. We have a lot of experts who could help out. We'll be happy to discuss with you.
The city's continuing services to immigrants are very positive, especially in this current climate of fear among undocumented immigrants. However, I would like to know if the budget for these kind of services for immigrants is covered locally and for how long, and if federal cuts will affect the health program at some point.
Okay. And then any other questions?
My question is, like, for the health things of this situation that we appreciated. But there is a news that the people who have no legal documentation, the federal government is going to start the social security income as well. So you are also in the health and human resource services. So what the city is gonna do for those who are gonna get started in social security because they have no legal status in this country.
Thank you. I'm gonna pass it on to Commissioner, and then we'll go through the principals so that way they can address your questions in their closing remarks.
Well, thank you so much again for your presence here and for your continued partnership and making sure our communities get the information they need. Like I said earlier today, over half of all New Yorkers get their news from their own news outlets, from their own language communities. And so it's so important to be in conversation with you all and to get this message out. You know, I'll say this, you know, to your question and to the concern that you're all expressing. We recognize the amount of fear, the anxiety that our communities have right now. We're hearing a lot in the news. We're hearing a lot in social media. There's a lot of speculation and frankly efforts to put fear in people's mind that could possibly lead to self-deportation or lead to people going in the shadows further. What we're doing here today is pushing back on this fear, making sure that because of this fear, people do not stop going to their hospitals, going to their doctors, getting their medication. This is part of the efforts that we're making to ensure that immigrant communities continue to feel at home and continue to be prepared for anything that may come our way, including mass enforcement, to continue to support families, children, and the most vulnerable who are impacted. But for now, we want to make sure that we're not adding to the fear, we're not adding to the anxiety that people have. We want to reassure them that we continue to be here for to my colleagues. One of our missions in city government is to expand the life expectancy of our New Yorkers, our fellow New Yorkers. We want to make sure that New Yorkers live long and healthy lives. But we cannot achieve our goals to expand that life expectancy if we do not address the issues impacting immigrant communities. 40% of all New Yorkers are immigrants. 60% of all New Yorkers are immigrants and children of immigrants, which is why this is so important. And the report published by the Department of Health and Mental Hygiene is so important because it lays out what we need to know and helps us develop a blueprint for how to address these healthcare issues that impact immigrants and all New Yorkers. So thank you, Commissioner, and your team for putting this report out. It's so important. You should all read it. You should write about it. And you should really, help us make sure that our communities are well taken care of. With that, I'll hand it over to, again, like I said, our amazing Deputy Mayor, who really is going to make sure that we're leading the way in support of our immigrant communities in New York City and beyond.
Thank you, Commissioner. I mean, these people are leading the way, right? Not so much me, and Commissioner, into my time, so I don't mean to chat and run, but I do have to run. But to your very, very pointed question, I think Commissioner Castro answered that. We are so reliant upon you to get this message out, this very critical message that we understand there's fear within this community, within these communities, and we understand why. But New York City remains strong, and we are continuing to ensure that these communities have access to the services that they've have always had access to, right? Healthcare, school enrollment, emergency services. We're focused on the health and well-being of all communities. That means immigrant communities as well. So if we're talking about the health and human services, that any supports that support them to help them thrive, we want them to come to our agencies. We want them to go to DOHMH and H&H. And then if you have questions about that, go to MOIA. and ask those questions, because we are here to support all communities. Thank you so much.
Thank you, Deputy Mayor, and thank you, Commissioner Castro, again. I don't have too much to add, but I do want to just emphasize again that we know that these are unique times. Part of the reason that this conversation and roundtable and the Immigrant Health Report are so timely is because we want the message to be clear. We know that this is a very difficult time, and we want to be clear that we are going to consistently show up for our immigrant communities and make sure that access to care is not compromised. And again, I know that that takes a bit of a leap of faith. It requires that immigrant communities, see us as trustworthy people in government, and we're here to say that that is what we stand for very clearly. I do want to acknowledge that some of the challenges coming from the federal government, particularly again threatening Medicaid and threatening public health funding, are concerns that we are looking at very closely. And we are also very concerned about data privacy issues around how Social Security numbers may be shared. Those are all things that we're looking at very closely, and acknowledge that that is a part of the reality that we are facing right now. And yet our commitment to the health of New Yorkers and the health of immigrant New Yorkers is unwavering. Every New Yorker without exception, and that continues to be our commitment.
Thank you, Commissioner Morse and Commissioner Castro. I would second the call to read the report. It's incredible, has so many important insights, and it's going to be an important tool for us moving forward to ensure that we're taking care of all New Yorkers, including immigrant New Yorkers. And I would close by reiterating that same commitment to taking care of everyone without exception, regardless of immigration status or ability. One of the beautiful things about the idea of any public service, I was trying to explain this to my 5-year-old yesterday, is that it's a commitment we all made as a city that everyone, no one is left out, right, from public services. And as New York City Health Hospitals, the largest public healthcare system in the country, we want to reiterate and send that message out as far and wide, regardless of what the federal government does. As Commissioner Moore said, our commitment is unwavering to taking care of everyone without exception, regardless of area status or ability to pay. And so we encourage you to continue to get the word out and share this information with the community. Again, our number 646 NYC Care is always there.
Thank you all.
Let's take a quick picture so that they can have a picture, and then we can do it.
We're gonna have